You wanted to know if there's any correlation between the umbilical cord being wrapped around a baby's neck and induction. And let's talk about induction for a second. Induction is not a bad thing. In fact, many women are induced, some electively because the doctor determines that her circumstances permit planning an induction date, and sometimes it's medically necessary for the mother's and or the baby's well-being. And in and of itself, it's not a bad thing. And induction will not affect the position of the umbilical cord. What will affect the position of the umbilical cord is the baby's movement. If you imagine the baby inside, they are connected to the placenta via the umbilical cord. And most umbilical cords are about like this long or so. Some are shorter and some are longer. And the umbilical cord is attached to the placenta, which is attached to the uterine wall. So there's an insertion site on the placenta that the umbilical cord attaches to. Now imagine holding a string and giving the other end to a toddler and having them run around, and of course they're going to get tangled up in it. And this is very similar to a baby inside the womb. They move around a lot, especially early on. They can be little acrobats in there and even do flips. And so the umbilical cord is going to get tangled. It could go around their neck one or more times. It can go around their body or around one of their arms or their legs. And actually, a third of babies are born with the umbilical cord around their neck. So it's not uncommon at all to see this. Now, what this speaks to is the importance of fetal monitoring during labor. And what this does is allows us to watch the pattern of the baby's heart rate and the contractions so that we can see how well oxygenated the baby is while they're inside of you. And babies will experience stress during labor. There's signs of stress that are typical and normal to see, and there's other signs of stress that warrant immediate intervention. And if we're not watching, then we don't know that we need to do something to increase oxygenation and blood flow to the baby. One of the patterns frequently seen in a baby's heart rate strip is a dip in the heart rate associated with contractions as an indication that the umbilical cord is being pinched. And oftentimes changing the mother's position will help alleviate pressure on the cord, and we can support the baby through labor. So as you can see, since it's very typical to have the umbilical cord around a baby's neck, like a third of deliveries or so, most babies do just fine through it. And it's very circumstantial. It's not necessarily something that will happen in future pregnancies, and it's not something that's affected by induction. If you have any more specific questions about it, talk with your OB provider. And if you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.